What we've been trying to do is find new treatments in the setting of patients who have failed previous treatments and have become resistant to previous treatments. The problem is, in that setting, that they have not only become resistant to the treatment that they've had, but we know from the way cancers evolve, they've become resistant to most other treatments that they could have had. So it's a very inefficient way of finding new treatments, and it tends to identify treatments that only work for a few weeks or a few months. So most of the drugs that we've introduced into the clinic produce very transient benefits. If we're going to change that, we need to start to look for treatments that are more effective in patients with early stage disease. So if we're going to change the outcome, we need to focus on early detection, early treatment, and adding new molecular treatments in settings of patients who have early stage disease who've never seen a previous treatment. And to do that, because these patients are frequently going to receive surgery or radiation as part of their treatment, we need to find a treatment that will fit in with surgery or radiation and indeed improve those outcomes. So my own research has been trying to find molecular targets that when added to radiation will improve the outcome. And we have to look for those targets in a new way, because since those patients have never seen treatment before, you have to do the trial in a way that will still permit them to go on and receive what could be potentially curative treatment. So we do what are called window of opportunity trials. We take advantage of the natural breaks that occur in treatment, the few weeks that may exist between cycles of radiation, the few weeks that exist before patients start surgery, to introduce a novel agent to see how the patients will respond to it in the setting where they've never seen any previous treatment. And we think that this methodology could revolutionize the way we identify new cancer therapies.